Interesting diagnosis of tuberous sclerosis. Tuberous sclerosis. It's this baby is 8 months, used to have convulsions. It's a minute video. I want you to have a look of the convulsive attack. They took a video. This is very helpful sometimes. So it's like she gets startled. Sorry, he gets startled. He's 8 months. You got that right? Yeah. It started at the age of 1 month. You saw it, it's not like an epileptic fit. It's like a startling feeling, It's like that. It's not like a full-fledged epileptic attack. You see the eyes turn away when he's having the attack. চোখটা একটু ঘুরে যায় না তখন? Yeah, that was one. So it's not a continued attack, it's like one paroxysm at a time. এক মাস বয়সে শুরু হয়েছিল তো? এক মাস. It started at the age of 1 month. He makes a moaning sound during passing urine. Moaning sound while passing urine. He gets recurrent cold. He gets recurrent cold with rattling. Sweats quite a lot on the back of the head. Stool is 2 to 3 days interval, so constipated. The mom said he's chilly, but we are not sure, obviously, because mom likes to put on the clothes. Not sure about that. Mom had a lot of anxiety during pregnancy with the in-laws, and there was a lot of discord with the in-laws. She was hypothyroid during pregnancy. She was diabetic during pregnancy as well. Normal delivery without any complications. I'll pass on the MRI report. To be very honest, I didn't have much to deal with, symptom-wise, very one-sided. Understand with this small boy. Sorry? For the thyroid and the diabetes? Yes, conventional treatment. They also mentioned that sometimes the attack comes on from cold exposure. So whenever there is an exposure to cold, that attack is more frequent. আর হয়নি তো তারপরে? মাঝে মধ্যে হালকা কম তো আগে থেকে। ওরকম হয়নি কিন্তু প্রায় এরকম ঝুঁকি মারে। You understand the attack? It's like just a jerk, Yeah, it comes like a jerk. Yeah, it's not like a prolonged epileptic attack. They came to us in November 2019. Initially, to be very honest, because I didn't have etiology, I thought of starting with thyroidinum. Because, why thyroidinum? In thyroidinum, what happens? There is always a maladjustment during one of the changes in a woman's life. So this mom, before the pregnancy, didn't have any issues. She started developing the hypothyroid during pregnancy. She had the diabetes mellitus during pregnancy. So a maladjustment, a hormonal change which developed during pregnancy probably could have an impact on the child. You understand what I mean? Because I hadn't a clear picture, so I thought on these terms, to be very honest, right? The second medicine I thought of is considering that degree of anxiety during pregnancy, right? In a child who has cold, recurrent cold, sweats on the head, I thought of Calcadia carb, right? Now if you see my thought process, I have thyroidinum on one hand where I just have the etiology. I don't have any manifestation to stamp my authority for thyroidinum, right? But for calcarea carb, I have a etiology to a certain extent, the anxiety during pregnancy. I have few manifestations. He's constipated, he has recurrent cold, he has head sweats. You understand what I mean? You see, trying to just balance it out. You have etiology on one hand, but no manifestation of heredinum. But for calc, you have an etiology of calc, which is anxiety. You know calc can be very anxious. You have the manifestation, which is constipation, which is profuse head sweats, which is recurrent cold. Also, sometimes the attack is precipitated from cold. Right? I want you to open Allen's, please, for calc carb. Calcarea carb Allen's. Did everyone have a look? It was like this. Look here, please. It's like a jerking attack, you know. It's not like a convulsive attack, but it's a jerking attack. There's a line in calc, in Allen's, uremic towards the end. Uremic or other diseases brought on by standing on cold damp pavements, working while standing in cold water, modelers or workers in cold clay. Allen's, calcarea, towards the end, just before relationship. Uremic or other diseases brought on by standing on cold damp pavements, working while standing in cold water, workers in cold clay. No artificial food.
I mean, no food general because it's not.
No. Just breastfeeding. And even if they tried to have outside food, she wouldn't take it. She just wants the breast milk. Nauseous when eating anything else. You got that line? Uremic or other diseases. Uremic means kidney symptoms, right? So kidney renal symptoms in calcarea carb can start post cold exposure. But do remember, in general, calc can have an etiology or an aggravation from, you understand here what's the line, working with cold clay, working with cold water. You can have an etiology or aggravation in calc from that. It's a neurological condition where it causes convulsions generally. Yeah. It causes convulsions. He was given heavy doses of anti-epileptics before coming to us, and he had become like a vegetable with that, you know. You understand, a 7-month-old child given phenobarbital is a very strong anticonvulsive. The name sounds very fancy, but you know, the effect is not that fancy, is it? November 2019, calc carb 200C. No change. December 2019, I went to 1M. To be very honest, I should have repeated a 200C and seen, but I thought it's more neurological. Perhaps 200C isn't helping. You know, straight away I shot to 1M. December 4th, they came to me, calc carb 1M. আগের দিনে কবার হতো এটা প্রথমে আসার আগে Previously, before coming to us for treatment, it was 4 to 5 times in a day, this jerk. না ওইটা হয় না তো এখন মাসে কবার হয় সেটা বুঝেছি সেটা হয় না সেটা মাসে কবার হয় সেটা একদমই হয় না In December 2019 to January, there hasn't been any attack. No attack since December to January. I followed them up on this January 25th. So it was almost like 90% better because there was no attack in between. Right? He's saying right now, he's doing like this. Dekho ki kore? I think this also got to deal with lack of strength of the neck. So, you know, he's unable to hold up the neck. It's not like a convulsive attack. He's saying that he's unable to hold up the neck and neck is falling down. But you see again the action of potency, right? The beauty of understanding the potency. Neurological symptoms. You know, many of us, believe me, I would have sometimes done this in the past as well. No change with 200C. I'll retake the case, prescribe some other medicine. No change in 1 month. But you see, maybe out of 10 you lose 2 patients, but you'll gain 8 if you stick with your medicine. If you're sure with your medicine, at least try any higher or lower potency before giving up on it. You know, that's what I wanted to share in this case with you. Right? 200C, absolutely no change, 4 weeks. Thank God they came back in 4 weeks. Yes. Right? I repeated, I went to 1M, you see, no attack after that. Medicine is same, just we change the potency. Yes, Alan.
You mentioned the section on uremic symptoms, but what was there in this child?
No, here it's no uremic symptoms. It's just the convulsion was worse from cold exposure. That's the thing what I wanted to share, that sometimes when he's having a cold exposure, there's a tendency for the spasm to come back. So they have worse from cold exposure in that way. Yeah, but it was not very marked, to have a specific remedy just for that. Ruben, could you elaborate on the tuberous sclerosis, please?
You're studying all over again.
I am studying because this is not
It's very helpful, believe me, with Ruben, because we get the other side of the picture as well. You have the MRI report?
Yeah.
Tuberous, 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 sclerosis, Sclerosis, sclerosis. He got these medicines. What are these? These are tranquilizers, phenobarbital, clobazam, anticonvulsive. The mom is saying she's concerned that he cannot sit of his own or cannot lie on the abdomen, right? I said if the convulsions start to improve, his general vitality will be good and he will be able to follow his milestones better.
Perhaps his milestones lag behind because of the medication.
Yes, that's true. He was sleeping all day with the conventional medicines. Allopathy should call them 4 months.
Yeah, during the young age.
You understand, at this age, 5 months.
So it's a neurocutaneous disease. It's a genetical disease, and the main concern with these patients are this is the head. In the brain, there it's a very tiny brain, but there are places where are originated some abnormal cells, and these cells they migrate. Yes, they go from one part to the another. So it's psychosis tubercular. Yes, and this finding is already here. He says multiple nodular projections seen within periventricular ridge. I mean, the nodular projections, it means that it has one center, and the cells are going away. So that's along some tubal how do you say, pipes, tubes. Yes. So that's the tuberous, and sclerosis means that these paths are getting harder. Yeah. Sclerosis is hardening. Yes. So that's the main concern. Beside that, no, he has no skin affection yet.
Here, देखा?
Yes. Okay, yes. These patients could have skin manifestations like hamartomas, which are benign tumors, and he has nothing in his kidneys.
পেটের ছবি করা হয়েছে? He has the moaning during urination.
Okay.
No, EEG. He has done no. They haven't done any
ultrasound. Okay, it would be good because because these patients are prone to kidney cysts. Yes, and in late stage, if it's not well checked, carcinoma of renal cells. But first of all, we have to rule out the cysts.
ঠিক আছে, আমি লিখে দিচ্ছি।
So the main pathophysiology is that one, the migration of the cells, of the abnormal cells.
Thank you. I'm not advising immediately for an ultrasound, but we'll see He's starting to improve, and I don't want a small baby to go through more investigations. Head sweats had reduced. কোথায় মাথায় ঘাম হতো? Those areas used to have head sweats, which he says has reduced. We're boosting today. Little bit. Very drowsy. Very drowsy. Not responsive. Eye contact was very poor. First time. Yes. I had asked him to reduce it by 50% with the first visit, but there was no change. I went to 1M and I asked them to stop if it's getting better. Yeah, so they stopped.